Thank you very much. Again, I'm going to talk about a project on welfare assessment of animals, of dairy cows or dairy cattle in the Azores Islands. I will tell you where these islands are in a minute. So I thank my collaborators. Monica is my student. She was there in the Azores doing most of the work, and the other are assessors that did the assessment at farms. So why is the assessment important? Of course, it's important to the animal because we allows to identify very early disease and pain and subclinical problems, and so it will lead to a better quality of life. But it's, of course, the assessment of welfare is also important to the farmer, and this is something that we try to transmit the farmer. We're not assessing welfare just because of the animals, but also because of the farmer, because this will allow to detect and look for solutions very early when there are problems. And of course it is important to society nowadays. We've been talking about this, important to the consumer, and that's why we now have all these kind of certification of welfare, because consumers are looking more and more for these kind of assessments. So building a protocol is difficult and should be well done, should be have scientific basis, strong and robust scientific basis, because we'll allow to identify problems in animals, will allow to train farmers, practitioners, and even students, will be a tool for farmers, and will be able to, for benchmarking, will be a good, also a good tool for benchmarking. Why did we thought of doing this assessment protocol in the Azores? Azores are small islands in the middle of the Atlantic, halfway between Portugal and the United States. They were discovered by Portuguese navigators in 1450 and 60. They're composed of 9 islands. And this study was done in the largest island called São Miguel, St. Michael, in which there are above 100,000 dairy cows. And for the Azorean milk producers, there is a problem. If they produce milk and just sell milk by the liter, it's difficult to compete with other countries, and even with continental Portugal, because they have to transport the milk to the continent, and this is, of course, expensive. So they have to try and sell what they have best, and that is the way they produce their cows. And the way they produce their cows is 100% in pasture. They have a very mild climate, although it's in the middle of the Atlantic, very mild climate, and they're grass all year round. And so this BEL, the French company, started a program called Happy Cow Program, in which they're now selling the milk with this label called Happy Cow Milk, for which they have some criteria, like pasture management, not using too much antibiotics, etc., etc., and also the welfare assessment. So they have a very strict, and that's why they asked our university to help them to build this protocol. So in this way, they will try to reach a consumer niche where people that will stop drinking milk when they think that milk are coming from cows intensively managed, and will perhaps go back to milk if they're sure that these animals are kept in more natural environment. Our university has been involved in protocol building in the AWIN project. That was a very large European project that finished 3 years ago, in which we built a protocol for dairy goats that is published in the internet, it's on paper, and even an app for use for people that want to use it in the farms. We also did the assessment welfare of the welfare assessment in intensive farms in the continent, Portuguese continent, and published some of these work using the welfare quality project protocol that is for intensively kept animals. So the Happy Cow protocol would be to assess the welfare of animal at pasture using the same kind of approach that the welfare quality and the AWIN projects use for intensively kept animals. Of course, we couldn't use the same kind of indicators, but this is the concept of the toolbox in which you validate indicators, welfare indicators, and then you choose the ones that are applied to the farm or to the system that you pretend to evaluate. So this evaluation started in 2016. All the 35 farms that were enrolled in the Happy Cow program were audited in 2016. Some were immediately approved, 35 were approved under condition, and 0 were not approved. I will explain how we did this approval or not. And in 2017, some were re-evaluated, others were considered approved and will be evaluated now in 2018, or have been, but I don't have that data here. Okay, so what is the protocol? The protocol starts with a questionnaire for the farmer, in which we look at if they have a health plan, the average lactations, the mortality, whatever, the use of the anesthesia in disbudding. This is, they would be not approved if they didn't use anesthesia and analgesia for disbudding calves, and a lot of other questions that they had to fulfill. The protocol itself, the assessment in farm, was done in this way. So in the first stage, looking at the animals at pasture, looking at QBA, I can't go into this in detail for the QBA, it's quality behavior assessment. If animals were isolated, ease of movement, thermal comfort, depending on winter or summer, we use the different indicators, of course, the quality of the water supply, and then these animals were brought into milking, and while they're walking to the milking parlor, we lameness scoring, look at the cows with horns, and the herding quality, so the human-animal relationship, if it was good or not so good. In the milking parlor, we looked at other indicators like body conditioning scoring, agonistic behavior, and all those, and then at the milking, look at some of these indicators. So in this way, we try to cover all the 5 freedoms and quality of life, reduce stress, reduce disease, lesions, and all that you know already. This is in Portuguese, sorry, I didn't translate it, but it's to show how we worked. So for each indicator, we have different grades, 1, 2, and some indicators up to 3, and then and the thresholds until what is acceptable, what has to be changed, and what is unacceptable. And for that, we'll give a green color, a yellow, or red. So farms at the end will have, I don't know how many indicators in green, in yellow, and in red. These are the survey that we use at the farm, that we put the number of the cow, and we individually assess each cow when we do the protocol. And so at the end, these are lists of some of the farms, and we can see that some farms are green all down, the indicators, some have some yellows and some have reds. If they have 1 red, they're not approved. If they have up to 2 yellows, they have a time to change, and they will be re-audited to see if they've improved those parameters or those measures. This program received an award by Compassion in World Farming, because there was really an improvement, and this award has been renewed now in 2017 and 2018. At the moment, the company is looking for an international auditing. So we did the protocol, but it was national and voluntary. But they were looking for to be approved by this organization that is now at the moment auditing the farms. We also have a protocol for calves. It's the first time that there is a protocol built for calves. Even the welfare quality doesn't include the calves, the small calves. And then for the calves, we had quite a big problem in some of the farms. They have very, very poor quality rearing and a lot of problems, and so things are improving, but very, very slowly. I brought these are some of the results. So you can see that 10 in 2016, 10 were not approved. In 2017, things improved a lot, and so at this stage, only 31 are approved, but under condition. They still have to change something. So completely different from the cows. This has been very important because production is changing. These are only 35 farmers that are using that are in this happy cow program. Other farmers want to get into the program, but it's not possible because they can't sell all the milk. They're paying more for the milk, of course. And you can see by this sign, this is a sign put by the farmer at the entrance of his farm, showing that he's proud of being part of the program. So that's an important thing. So farmers are changing, they're proud of being a farmer, and welfare is changing. If the cows are happier, I don't know, but at least we now look at the problems. This is just a picture to show a difference between what was before the protocol application. You can see there a calf unit, terrible calf unit with the animals drinking from the buckets below. No light inside, the ventilation, you can imagine what's in there. And on the right picture, you can see the same farm after going into the program and having to change to be in the program. And you can see that the light is better. You can see one of the criteria is that they have to drink from a bucket with their teeth. They can't drink it from the bucket below. Has a better light. You have 2 or 3 animals per pen, and etc. etc. So they will improve if you tell them how to do it. So, and thank you again.